All right, if you or someone you care about is dealing with hepatitis C, you've almost certainly come across the term HCV viral load. Today, we're going to pull back the curtain on this super important test. We'll break down what it is, how it works, and honestly, why getting your head around it is one of the most powerful things you can do on your treatment journey. So, let's just start with a really big question. When you're managing hepatitis C, is finding out you're positive or negative really the whole story? Well, the short answer is not even close. To really fight this virus effectively, we need to know a lot more than just whether it's there or not. Okay, so here's our game plan for this explainer. We're going to cover 5 key things. First, why this test is so critical. Then, what viral load actually means. We'll dive into the cool science of how the test works, learn how to read your own report, and finally, see why it's truly the backbone of Hep C treatment. First up, why does this one test matter so much? Well, it's all about getting way more specific than just a simple diagnosis. Think about it this way. Knowing you have hepatitis C is like knowing there's a fire. But this test tells you how big that fire is and how quickly it's spreading. And that information, it's absolutely crucial for your doctor to figure out the very best way to put it out. So that brings us to our next big topic. What exactly is this viral load? Well, at its heart, it's basically a counting game, happening at a level you could never ever see. Now, the official medical name is the HCV RNA Quantitative test. I know, it sounds a little intimidating, but let's just pull it apart. HCV RNA, that's just the genetic fingerprint to the virus. And quantitative, that's just a fancy word for measuring the quantity, or counting the exact number of virus copies. And where are they doing all this counting? In a super specific, tiny amount of your blood, just 1 single milliliter. That's it. This gives doctors a really clear, standard way to see how concentrated the virus is in your body. And, this isn't just a one-time thing. This test is like your partner through the entire treatment process. Before you start, it gives you a baseline, a starting point. During treatment, it's your progress report. Is the medicine actually working? And after treatment, it's the final check to confirm, yes, the virus is gone. So how in the world does a lab count something that's literally invisible? Let's get into the science of it and look at the amazing technology of RT-PCR that makes it all happen. Okay, so here's the main challenge. The hepatitis C virus is what we call an RNA virus. You can think of RNA as its native language. The problem is, the powerful lab machines that do the counting, they only understand a different language, DNA. So the very first step has to be translation. This whole process, called RT-PCR, happens in 3 key steps. First, that translation step we talked about, it's called reverse transcription. The lab turns the virus's RNA into DNA. Step 2 is amplification. The machine basically acts like a super fast photocopier, making millions and millions of copies of that new DNA. And third, fluorescence detection. Here's the magic trick. Every single time a new copy of DNA is made, it gives off a tiny little flash of light. So the machine isn't really counting the virus itself. It's counting those little flashes of light. And the logic is beautifully simple. The more light it sees, the more copies were made, which means there was more virus to begin with in your blood sample. More light equals a higher viral load. Okay, now for the part that I know you really care about. What does your own lab report actually mean? Let's break down the results you are going to see. Generally, your report will show one of 3 things. Target not detected, or TND, is the best news you can possibly get. It means the test was so sensitive it couldn't find even a single trace of the virus. A low viral load means the virus is there, but it's not multiplying all that quickly. And a high viral load means the virus is really active, which, over time, can increase the risk of liver damage. You'll see the number on your report measured in IU/ml, which stands for International Units per Milliliter. Now, your doctor is the one who will interpret your specific result for you. But just as a general rule of thumb, a common benchmark is 800,000. Anything above that is often considered high, and anything below it is considered low. All right, let's head into our final section and tie this all together and see how this one single test really is the backbone of your entire treatment. This quote really nails it. So why is it the backbone? Because it provides the solid structure for pretty much every big decision your doctor makes. For example, if your viral load is really high at the beginning, your doctor might decide you need a slightly longer treatment course to make sure you clear the virus completely. It's that direct link from the number on the paper to the plan you follow. At the end of the day, what this test does is allow for a completely personalized, data-driven plan for your health. It absolutely empowers your doctor to build a treatment just for you. But you know what? By understanding it, it empowers you to be a more informed and active partner in your own healthcare. So, I'll leave you with this to think about. Now that you know the what, the why, and the how behind this test, what's one question you're going to ask your doctor about your viral load report at your next appointment? Because being informed is truly the first step to taking control. Thanks for joining me.